Volkman ischemic contracture, sequelae of compartment syndrome of the forearm, causes muscle ischemia from compartment syndrome or brachial artery injury. Contracture position: elbow flexion, forearm pronated, wrist flexion, thumbs adducted, MCP joint extension, and interphalangeal joint flexion. Volkman sign: able to fully extend interphalangeal joint only if the wrist is flexed. Classification: Swaj-Suj classification: mild, moderate, severe. Mild, finger flexors affected. Moderate, fingers and wrist flexors affected along with median ulnar nerve. Severe, finger flexors and wrist flexors as well as extensor affected. Treatment: for mild, when the finger flexors are affected, no sensory deficit, dynamic sprints, common flexor tendon release or tendon lengthening. Moderate, when flexor of fingers and wrist flexors are affected along with median ulnar nerve, radical release, FDP lengthening and transfers, brachioradialis to the flexor pollicis longus and ECRL for FDP tendon transfer.